we get medicine free, and we can see a lot of things. Most of things when he's been going to do it, may God allow him to finish this tenure, because we are very appreciated. So thank you for all we see now. They test me free and also give me medicine free. So I'm very appreciated.
To mataya da Muhammadu Buhari da wannan taimakon da ya kawo wa talakawa. Mun samu magani kyauta, ana duba ran lafiyar mu a bamu magani. Saboda haka muna musu godiya da mu da yayanmu, ya Allah ya kare cin gaba, kuma Najeriya sai Buhari. Sai baba, in Allah ya da Allah ya daukake shi ya kuma kara mishi lafiya. Sai baba insha Allah. Ko ina na guda yau in dai lokacin zabe ne sai na dangwala mu baba insha Allah, sai baba. Allah ya kara daukaka. Mun gode, mun gode.
A lot of structures will have to be put in place. Infrastructurally, we need a lot in this country. Then the human resource also, we need so much, especially in the area of medical doctors, specializing in various fields and even subspecialties. We need a lot in that direction. And making health available to people is another thing that can help us to develop healthcare. Because if you have healthcare facilities concentrated in urban areas and the people in the rural settings or resource-poor settings cannot access the health, then you've not improved anything. And even making it affordable is important, because a lot of people don't have money to go to hospitals, so they continue to patronize quacks. And when you have so many people, or perhaps majority, patronizing quacks, you cannot say you are improving your health care. So it's a whole lot of a problem. A lot has to be done, and it's not something one can just stand somewhere and begin to provide solutions. Committees will have to be put in place. A committees on health services itself, a committee on health research, committee on so many other areas that should come up with recommendations to government. In the area of equipping hospitals and also hiring human resource. So the political will is there. The problem now is the funding. You may have the will, but the funding may not be there. The money may not be enough, and you have to spread money across other sectors of the society. But I know the political will is there, and we are quite hopeful with the way the present president is handling things, especially his focus on the resource-poor persons, very poor persons. A lot will still happen in the area of primary care and national health coverage, especially for the vulnerable groups. The real people that are contesting election will never be involved directly in violence, neither with their own siblings and children. They will never get involved. The people that will do violence are people that are outside the circle of people that are looking for power. And so I want to advise young people, they should not allow themselves to be used, because these people will use you and leave you and dump you, and that is the end. And so if this group of people refuse to be used, then there will be no violence. So we should all work towards ensuring that there is no violence, which means all families should be involved. Parents should talk to their children, let them not be used. If any politician is asking you to go and do something that is unlawful, just tell the person, let his son come and lead the group that will do the fight. If his son is able to come and lead you, okay, you can now follow. But I am sure there is no child of a politician that will come and lead any group for fight. Yeah.
Thank you very much.
Thank you.
There is a need to let them know who we are and what we are out for. Basically, healthcare services is just for the less privileged, especially in this environment. We studied them, all of them, they cannot afford the basic health services. So we just choose that, okay, at this point in time, let's come out and see and how the response will be. And so far, it was very needy. And we see that we should actually do more if we have the means of doing it. If I am in position better than this, I will advocate for government to actually come down and see for themselves, because so far what we have seen is actually very bad. That common as malaria, they could not afford. Some of the cases we've seen that we said, okay, this case needs a referral to a very close by. Just transport money, they tell you they cannot afford it. And that is how important it is. And life, as we know, is equal. All our lives are equal. And these people are really in need. If government can come close, like encouraging if it's private sectors, encourage them to come closer. How will they encourage us to come closer? Look at the access road to this place. It's something that discourages people. Like yesterday, there was an accident case. For them to come here, we hear so many things. So if government come close with some of the amenities, it will encourage us to do more. Like other private, like public health services. If the government can bring it closer to in whichever way they want to subsidize the care for them, it will be very important, especially national health care insurance services. If it's here, I'm telling you, there won't be much health burden the way it is now. You are ready for any emergency during this time period, because most of the stores will be closed. And that day, you may be looking for as common as IV fluid, you may not get it. But we stock our facility here for the same program, free healthcare services. We have over 200 different types of drugs that we came with. The lists are there. So that is how ready we are, and we've been doing it. It will continue till the end of the month.